Milwaukee. Thank you, Senator Cassidy.
I will defer to Senator Braun.
Thank you, Mr. Chairman and Senator Cassidy. This is just another egregious example of a broken healthcare system. When you can have a story like this, I just spent time with someone yesterday, and this was on an ERISA plan. I think the claim was about $4.2 million that the company had to end up paying the provider $875,000, and then the insurance companies and another middleman in it got nearly $3 million. And the owner ERISA plan had to end up paying that bill, didn't have enough transparency to actually make a decision that would have prevented it in the first place. And you know who was suing? The provider that only got $875,000, and the insurance company's other middleman got over $3 million. That should never be happening in a system. I fought it my entire career as someone wanting to offer great health insurance. Took it on back 16 years ago. Proudest thing that I did was created healthcare consumers out of my employees. Didn't think that was reasonable to have your bill, your health insurance go up 5 to 10% each year and be told you're lucky. This is part of a broken healthcare system that even doctors and nurses and independent pharmacists don't want to get into anymore, because it's been taken over. When private equity gets into emergency rooms and gets into something, that's because it's easy cash flow. That's okay if you want to do it on something that isn't critical, if the marketplace allows it. Here, it ends up in a story like this. It ends up to where we're paying twice as much as most other countries are for health care, and in many cases, we have poor results. I give you that description of another aspect of the system that I just described. Look at how many resources are being wasted. And then you look at this egregious example, something's got to give. Senator Sanders and I have put out a template based upon competition and transparency, getting rid of the barriers to entry. It would be a far bigger reform of a broken industry than what government has attempted to do in the past. And I think it ought to put the industry on notice, from insurance companies to hospitals to the whole gamut. The only ones not liking the system are the practitioners that live within it, and they're not happy about how it's evolved. Because we got to do something to fix it from the ground up, or we're going to hear more of these tragic stories. I got a question here. I'm going to ask it. Let me get to it here. It'll be for Mayor Mitchell. Told you about the bill we've got that's going to create strong transparency. It's going to engender competition. It's going to try to chip away at this story and others, and there's so many of them, and make you sick. I'm wondering if greater transparency would have been helpful in the fiscal condition of Glenwood Regional. If there was more information for people to see out there, do you think it would have made it an easier navigation in terms of what you had to go through?
Yes, I think so, and thank you for the question. Even as a board member, I mean, we didn't know. It was always presented that Glenwood was profitable. It was actually one of the most profitable hospitals in the Stewards system. We didn't even know, and there were rumors kind of in town, maybe in the summer, late summer of 2023, about some local vendors not being paid or being slow to be paid. But it really was not until September and October when the realization of the seriousness of the issue came about. And then all of a sudden, I mean, we were in immediate jeopardy in December. And at that point, there was, not a whole lot that could be done on the local end of it. I've been mayor 6 years. This is by far the #1 topic that I get calls, comments, texts. People I don't know stop me in the grocery store asking, please do something about this. And it just all came to head kind of just all of a sudden. So transparency would definitely, I think, help the situation.
I think until healthcare consumers who have atrophied within a broken system that many times are fearful that their own insurance plan is going to be there for them after they get the bill 4 to 5 months later, it's all got to change. And if
Agreed.
it's not involved with a engaged skin-in-the-game consumer in a system that, if they want to call themselves free enterprise, has to start responding. Otherwise, you're going to see this egregious issue, many others like I described, and then, yes, a system that could still be repaired will have to be run like every other country does it. Industry, wake up. Thank you.